Hello, I'm Dr. Robert Grant. I'm the Senior Clinical Associate Dean for St. George's University School of Medicine. I'm delighted to be here in the UAE to talk about anything and everything that has to do with St. George's University and the progress to become a physician so that you can practice medicine in the United States or the UK. Delighted to be here for the interview. Thank you so much for the invitation.
Dr. Robert, welcome to Dubai.
Thank you.
So good to have you at MediPathway. Thank you so much for your time. We're just going to have some questions we've taken from our audiences, and we're gonna ask you those questions, and we would be really grateful if you could answer them, helping our students, on their journey to become medical professionals. So mostly students here in the UAE are not aware of the basic difference between MBBS and MD. MBBS is more of a British qualification, MD is a US qualification, but there's a little bit of difference between the level of education as well into it. So could you kindly give us a little bit about what is the main difference between an MBBS qualification and an MD qualification?
Well, first of all, thank you for the invitation, and to all you and your team at MediPathway.
Thank you.
It's been delightful. You've been fantastic hosts and made me feel very welcome here.
Thank you so much.
The difference is exactly as you point out. They're both pathways to eventually practicing as a clinical physician. One follows the UK model and the other follows the US model. In the UK, the model is a 5 or 6 year pathway that incorporates what we in the US would call undergraduate studies, and then progressing into the specific study of medicine. Whereas in the United States, our students get an undergraduate degree first and then get into medical school to practice.
Okay.
So the degrees are a little bit different, reflecting the different pathways. St. George's University, as an international school, has a MD curriculum that's focused on an American model, but has pathways programs and foundational programs that follow a UK type of paradigm. So we're able to offer both. The reality is our students, when they graduate from St. George's University, will get an MD degree. And students, if they go to one of our partner universities, will get a bachelor's degree before they get their medical degree.
So, as you know, UAE is a very diverse country. We have multiple curriculums. We have the Indian CBSE curriculum. We have the British Cambridge system. We have the IB curriculum. We have the German curriculum. We have the Russian curriculum. There are so many different kind of schools operating in the UAE and in Dubai as well. So for a student who's just finished his high school, which could either be grade 12 or 13, what is the route SGU offers for that students to pursue a MD degree?
So the reality for SGU is that we can help any student wherever they are in their educational paradigm. Since as an international school, we are thrilled to have students from the UAE as well as other countries who have different educational pathways and experiences before they are academically ready to tackle the somewhat challenging pursuit of medicine and the MD degree. So the typical student that you would recommend, based upon their grades and a review of their transcript, would qualify for one of our programs where they would spend 5 or 6 years studying medicine. The first 2 years would be either in Grenada at St. George's University or at our sister campus in Northumbria University in Newcastle, where they would get everything they need to be able to succeed academically and then advance directly into the first year of the 4-year MD specific curriculum. The 4th year for those students, the 2nd year of our basic science paradigm is done at Grenada. And then for all students, the final 2 years are done at one of our nearly 80 hospital clinical affiliated sites in the United States or the United Kingdom. This way our students can individualize where they want to go for whether their academic requirements are such that they need a 6-year program, a 5-year program, or just the 4-year program.
Okay, that's really exciting. I think, so what I understood is that any student who's completed their high school can pursue a program at St. George's University. Could be a 7, 6, or 5-year program, preclinicals before that, and then afterwards pursue their the 4-year MD program. Can you just explain a little bit about the 4-year of the MD curriculum? What would they study in those 4 years?
So the reason that we have a specific 4-year curriculum for the MD degree at St. George's is because our school was founded on an American type of model.
Okay.
And in an American model, medical school is 4 years long.
Okay.
And so our model mirrors that. The first 2 years, the student focuses on what we call the basic science phase, where they're learning in disease-specific types of approaches, all about histology, anatomy, physiology, histology, the basic cornerstones of what a doctor needs to know in their fund of knowledge to have the context to understand clinical medicine. Mm-hmm. In the second phase, the final 2 years of our 4-year curriculum, they spend time away from a specific campus, distributed to one of our clinical affiliated hospitals in the United States. They are teaching hospitals, exactly right. Okay. The first of those 2 years, our third year of the 4-year MD curriculum, we have our students do what we call the core rotations. Okay. And by core rotations, we mean rotations in medicine, surgery, psychiatry, pediatrics, OBGYN, and family medicine. Mm. That way, the student is exposed to the broadest, widest specialty of medicine as a whole. Mm-hmm. The fourth year has a couple of functions. First is to allow the student to identify what kind of doctor that they can be. Because after graduation, the student needs to then do additional education called a residency training to learn to become a specialist in that particular discipline. Okay. So in the fourth year, they take electives to figure out what kind of doctor they want to be, as well as doing rotations at different hospitals, perhaps than where they did their core rotations, so they can figure out what particular geography they want to be in or what particular hospital they may want to train in, because each of the specialties has different strengths depending upon where it is in the United States or the UK and where the student wants to be based upon their own personal circumstances, family, country of origin, or other reasons.
Okay. So before we go to residency, I would really like to dig into that as well a little bit. But at the year 3 and 4, which is your clinical rotation, I know you're the associate dean of St. George's for those particular years. Do the student need to do any kind of licensing exams like USMLE or UKMLA? Any exam needs to be done?
Fantastic question. Yeah. And we need to have our audience understand that the licensure process is completely independent of the medical school process, because we have students who have practiced now in up to 150 different countries, so they each have their own licensure pathway. Yeah. Yeah. So into our curriculum, we are able to integrate most of the major pathways to get licensure, those being from the United States, from the United Kingdom, and from Canada. And the students are taking those stepped exams at different stages when the curriculum of the school has readied them in order to get the best chance of succeeding when they take that exam. Okay. So for an example, in the United States Medical Licensing Exam, the USMLE, the first step of it is typically done after the basic science phase is concluded, but before you start the clinical rotation.
Between year 2 and year 3.
Before year 2 and year 3. Yeah. The step 2, which focuses more now on the clinical knowledge that you've learned during your rotations, is typically taken sometime at the beginning of the 4th year. Okay. And then the third part is typically taken by most physicians when they are doing their first year of their residency program. Okay. Successful completion of the licensure allows them to be eligible to apply for a license to practice in each of the 50 states and additional territories of the United States, because unfortunately in the United States, it's very decentralized. You don't get a national license to practice. You only get to practice per state. Yeah. The next step that often gets confused is the process of board certification, which is different than licensure, but very complementary. In other words, every doctor, regardless of what kind of doctor they are, needs to get a medical license. But if you're a pediatrician, you need to get board certified in pediatrics. The licensure is done by a governmental type agency. The board certification is done by a group of your peers, and it is called the American Board of that particular specialty. That board is basically a bunch of peers who have created an examination, both written and oral, for you to have to pass to demonstrate that you have not only the knowledge, but the clinical skills in order to be considered a specialist in that particular discipline. Okay. It's important now in the States because for all practical purposes, to be able to get privileges to admit patients to a hospital or to be able to take care of patients who may have a particular kind of private insurance, you need to be board certified.
Okay.
So it's possible to practice without board certification, but in all reality, it's really a very limited practice unless you're able to successfully complete the board certification. The board certification is done at the end of your residency, so 3 to 5 years after you've graduated from medical school.
So you mentioned that with St. George's University, you have more than 70 teaching hospitals who are on your panel. How does a student match with that clinic? For example, is that based on geographical choice? Like if I have relatives in New York or Chicago, can I choose a hospital there? Or is it based on my grades? Like how did I do in my first or second year? How does that the logic behind it is figured out from a student who's finished year 2 and now is going for their clinical rotation? How do they make that choice?
There are some states in the United States that require students to have successfully completed step 1 of the U.S. medical licensing exam before they can start doing clinical rotations. Those are New York, New Jersey, and to a certain extent, Florida. So if a student wants to do rotations in those states, they must have passed step 1.
Okay.
If the student, and we have practice exams to help students guide to determine their readiness for success of step 1. If those screening exams show that they're not quite ready yet to take step 1, then we have lots of options for the student to continue their education and start their clinical years in states that don't require step 1.
Okay.
So those typically are in the Midwest or the western and southern parts of the United States.
Okay.
So the most options are available to students who are able to successfully complete step 1.
Step 1. Okay.
And when they get their notification that they have completed step 1 successfully, because we have a rolling academic year, we have 6 start dates throughout the year.
Okay.
We then offer to the student, we say, here's the availability on this start date. And if the student sees something that they like, then they say, okay, I'm going to this hospital. That's great. If they don't like the options that are available, they may have to wait 6 weeks and then start in another site. But we have plenty of sites. We have plenty of opportunities so that no one has to wait for availability of a spot. It's just they may have to give a little bit of time and be patient if they have a specific location, as you say, because of family or other types of requirements.
So how flexible is this system? For example, if I am a student who started my medical degree journey, I was set on becoming an orthopedic surgeon. But while I was doing my clinical rotation, I found that I'm really good at internal medicine or at psychiatry or some other field. How does that make a difference for a student? How is the system flexible enough that they can choose electives later or their residency programs later, or how does that work?
So there are a lot of moving parts, and you ask an excellent question. Foundational to all students is the better their academics, the more choices that they will have. So that's why all of what we do primarily for our students is help them with their ability to perform as well as they can academically and on standardized tests.
Okay.
So that's step 1. Step 2 is determining what your interests are and understanding that while the total number of first-year residency positions in the United States is still a little bit higher than the total number of candidates, both from U.S. domestic and international medical school. But there's an imbalance if you are interested in a competitive specialty like orthopedic surgery, where there's almost 3 times as many qualified applicants as there are residency training spaces available. On the other hand, a specialty like family medicine has less than 1 applicant for every spot. So it may be, based upon your academics, your background, that while you want to be an orthopedic surgeon, the odds are that you may not get a position in orthopedic surgery. So our team of advisors who works individually with the student would outline a potential plan B. In the orthopedic surgery example, there are sports medicine fellowships, and those happen at the conclusion of a family medicine residency. So while you might not get to be the kind of orthopedic surgeon who would be doing hip replacements and knee replacements, you'd be the kind of sports medicine trained doctor who can take care of the injuries that weekend warriors happen, take care of joint sprains, do the musculoskeletal kind of therapy that a lot of people think they want to do when they think of what an orthopedic surgeon does.
Yeah.
So there is flexibility.
Okay.
Even if you go into your specialty training, and the way that specialty training is assigned is based on something called the National Residency Matching Program,
System,
which we're just going to call the match.
Yeah.
So depending upon how you do in the match determines what specialty and what location you're going to be. Very simply, you apply to hospitals and disciplines, and the hospital can decide to interview you. If you've been interviewed at a hospital, the hospital ranks from 1 to however many people they've interviewed, and you rank however many hospitals you would consider training at. It goes into a computer algorithm, and on the second Friday of March every year, all of the candidates find out where the match worked out.
Okay.
So if you had been matched into family medicine, you find out which hospital you're going to be at, and therefore you know that's where you're going to work for the next 3 to 5 years. Now, people change their mind. They are people, and there is choice. And about 15% of people during their residency program change their mind.
Yeah.
And that gives opportunities for people to shift from one particular kind of program to another. Now, it's not predictable, and it may be a little bit of a challenge to work into your timeline. But most medical students who become resident doctors are very resourceful and figure it out. And if they really want to switch from being a surgeon to being a radiologist, they can make that happen.
Yeah, I'm so glad that you touched on the residency part and explained a little bit. But for me, I'm going to ask you a question from the student's prospect.
Sure.
So I'm a student. I finished my first 2 years of basic sciences. Under your leadership, I did another 2 years of my clinical rotations. I passed my USMLE 1 and passed my USMLE 2. How do I secure a good residency? What are the factors for me as a student to keep in mind in my 4 years of journey, so that I know that if I want to get to a specialist residency program, what things I need to collect so that when I apply to that teaching hospital, I am one of the more favorable students or highly ranked students which they would consider.
So the good news is we are a data-supported organization,
Awesome.
Given our scope, and that we put over 1,000 graduates each year into first-year training positions in the United States. So we have a lot of information to share with each individual applicant for residency training who graduates from SGU. While each of our students is a unique person, we have probably 1,000 students in the last 5 years who have the same academic profile, the same interests, the same geographic type of desires. So we can really give student evidence about, here's someone who was just like you and what decision they made and how it turned out. As we review that data, the two most important factors are your academic performance.
Absolutely.
And then a letter of recommendation from someone who will advocate for you in that specialty.
So your doctors at your clinical rotation could be...
The doctors in the clinical rotations, because our clinical affiliates have residency programs in those disciplines. And we believe in what we call the pipeline model, where we pick good students. The students do an impressive job during their time in the clinical years, year 3 and 4. The hospitals want to recruit them into their residency training programs. And then at the end of the residency training program, they become a pool of potential employed physicians that can work in that hospital or in that health system. So it's a very lean, mean, and well-structured machine to get students from preclinical training through the clinical years to a job of well-employment in the specialty that they want down the end of the road.
And if I understand right, the residency is a paid residency, right? The students make $60,000 to $70,000 per year as a first-year resident?
Yes, so the residencies last 3 to 5 years in general. Some students decide to get even more specialized and may do additional years of training before they go out and either join a practice or open their own clinical practice. But yes, the salaries are starting in that ballpark and then get increased every year, so that if you are still a resident after 6 or 7 years, you're making $125,000 to $150,000 a year.
Going to the basic questions of like Caribbean again is a new market which a lot of students are now finding out about, and some of the research on the internet is not that positive about living in the Caribbean. I personally have been to the St. George's campus. It's an amazing campus. Very secure. I saw the security operations room, over 800 cameras. They have a lot of security over there, and I felt very safe. I was very happy being part of the fam trip. Just for the students, may I know the kind of diversity of the students? What kind of students do you have on campus? Where are they mostly coming from? And how safe is it to go and study in the Caribbean?
A fantastic question. So the first thing to know is that St. George's was the first international school to be based in the Caribbean. And my personal opinion is that we are the best.
Okay.
We have the longest history, approaching 50 years this year, celebrating our anniversary. And there are a lot of copycats.
Yeah.
The thing that distinguishes us is that St. George's is now a true university. We have as you described, a beautiful, modern, state-of-the-art campus, but are not just a medical school. We are a school of arts and sciences. We are a veterinary school, a nursing school, a school of public health, with over 6,000 full-time students on campus. As a result, there's a great community and a large enough presence that we are well known and well respected, and probably one of the most, if not the most dominant private employer on the island itself. The island is a beautiful Caribbean island, and yes, the campus is right on the beach. But I didn't realize this until I visited. It's close to the equator. So the days are always about 12 hours long. Unlike where I'm from in New York, there's no beautiful dawn or dusk. At 6 o'clock in the morning, the sun comes up, and at 6 o'clock in the evening, the sun goes down. And while there's lots to do in terms of restaurants and nightlife and other activities, when it's dark, people tend to study, which is a good thing to do. They're not distracted by the potential things that they would maybe want to do if it was daylight out. About 70% of our students are American citizens. About 10 to 12% are Canadian. And the rest come from literally all over the world. And it's wonderful to have them in that sense of community together, whether they're in Grenada for the campus there or at our satellite campus in Northumbria, in Newcastle, United Kingdom, where there's a real sense of community. So they're supported, numerous clubs and activities. This really distinguishes us from the 30-odd other international schools based in the Caribbean, because they tend to be much smaller and tend to have just one building where all of the students are all of the time. So it is a very different type of experience. Those are all medical schools. They don't have this opportunity to do a 5 or 6 or 7 year program because they're not a true university the way that St. George's is. The campus is very safe. It's a quick 5-hour, 4.5-hour flight from New York. I can catch the 7 o'clock flight in the morning from JFK and be at work at 1 o'clock in the afternoon.
Awesome. For students who are from this part of the world, as I said, diverse backgrounds. I'm from Pakistan. I lived in Dubai for 13 years. My kids are studying here. We have people, 200 plus nationalities. Coming back to the UAE after your board certified, how easy is that process? Do you have any advice for students who are thinking to complete their education in the US, get their board certification, and plan to move back to the Middle East? How easy is that for them?
So the wonderful thing is that U.S. board certification, which follows the residency experience, is considered the gold standard of education throughout the world. And that's one of the reasons why we've been so proud that our students have graduated residency training in the U.S. and fanned out to over 150 countries around the world. So each country, just like each state in America, has their own nuance about getting a license. Having that degree of gold standard education usually makes the ability to go back, whether it's to the UAE or another home country, and practice without much difficulty.
Okay. Before I let you go, Dr. Robert, I would like you to give advice to prospective medical students, anything you would like to say to them before they start this amazing journey to become doctors? Anything you would like to say, that would be really amazing.
Well, thank you again so very much. I congratulate and salute you if you are considering a career in medicine. I think it is the most impressive career to pursue because you will make a difference in the life of another human being. I guarantee it. No other career will you be able to reflect back and say that I made a difference in another person's life the way you can when you became a doctor. And not only will you make a difference in just one person's life, but over the 20 or 30 or 40 years of your career as a physician, you will make a difference in many, many lives. People will entrust you with their deepest fears, their hopes, and their dreams, and you will become a trusted advisor and partner in order to allow them to live their best life possible. Going through medical school is not easy, but we don't want it to be easy because we want people like you, the best and the brightest, to pursue practicing in medicine. I'm selfish. If I'm sick, I want the best, smartest, most competent doctor to be caring for me or to be caring for my spouse or my parents or my siblings. The calling that one pursues is not a job. It's not a profession. It is truly what one says, that if you find something you love, you won't work a day in your life. Programs like you have with Medi Pathways here in the UAE, as well as your school counselors and other mentors, they know and will be able to provide you with advice that will help you figure out how to make your dream come true. We win at SGU when we graduate the next generation of doctors. That's why we exist. And more importantly, the mission of St. George's is to truly educate doctors to treat the communities, the backgrounds where the patients are, because we know that outcomes are better when you're cared for by somebody who shares your background, shares your ethnicity, who looks and sounds like you. You are interested in applying. We have many pathways to help you achieve that goal. That's why we have many pathways, because everyone is an individual. You might be ready out of high school. You might not be ready right out of high school, but you may be ready a year or two or even 3 years later. The different programs we have, which you can learn more about, you'll be able to figure out what exactly is for you the right pathway when you make the commitment to become a doctor. I congratulate you for taking the time to listen to this podcast. I'd be honored to meet you when you come to SGU. The most fun I have is when I'm visiting the clinical sites and I get to catch up with the students who I meet when they come to Grenada and they start their journey in the first of the 4 years of the medical curriculum. You have a fantastic career ahead. The world will continue to change, but you are going to be there at a patient's hour of need. No computer, no AI chatbot, no avatar is going to ever replace the empathy and the compassion that you will bring to the care of the people who will entrust their lives to you. I wish you all the best in the years to come. Thank you.
Advice. Thank you, Dr. Grant. Thank you for your time.
Delighted to be with you all here today, and thank you.